Acute respiratory distress syndrome. What is it? Acute respiratory distress syndrome, previously known as respiratory distress syndrome, adult respiratory distress syndrome, or shock lung, is a severe, life-threatening medical condition characterized by widespread inflammation in the lungs. Although it can be triggered by a primary respiratory infection such as pneumonia, it is more often a sequela of sepsis or significant trauma. ARDS is a disease of the lung parenchyma that leads to impaired gas exchange. It is associated with pulmonary cytokine release, impaired endothelial barriers, loss of surfactant, fluid accumulation in the distal air spaces, and fibrotic changes.
Acute respiratory distress syndrome. Acute respiratory distress syndrome is a life-threatening lung condition that prevents enough oxygen from getting to the lungs and into the bloodstream. What are all the causes that can lead to acute respiratory distress syndrome? Acute respiratory distress syndrome can be caused by trauma, sepsis, shock, gastric aspiration, uremia, acute pancreatitis, or amniotic fluid embolism.
ARDS is characterized by the following criteria: lung injury of acute onset, bilateral opacities on chest imaging, respiratory failure, and decreased arterial papillary. Signs and symptoms. The signs and symptoms of ARDS can vary in intensity depending on its cause and severity. They include severe shortness of breath, labored and unusually rapid breathing, low blood pressure, and confusion and extreme tiredness.
Of a big inflammatory response, and that inflammatory response is really at the heart of this ARDS.
Here's what happens. Your lungs are made up of millions of tiny air sacs. They're in constant contact with your bloodstream, which carries oxygen throughout your body. Normally, barriers prevent water in your bloodstream from flowing into your lungs. When ARDS strikes, barriers break and fluid fills your lungs.
ARDS usually follows a major illness or injury, and most people who are affected are already hospitalized. Causes. The most common underlying causes of ARDS include sepsis, which is the most common cause, inhalation of harmful substances, breathing high concentrations of smoke or chemical fumes can result in ARDS, severe pneumonia. Severe cases of pneumonia usually affect all 5 lobes of the lungs. Head or chest injury, accidents, such as falls or car crashes, can directly damage the lungs or the portion of the brain that controls breathing.
Describe the pathogenesis of acute respiratory distress syndrome. In acute respiratory distress syndrome, one of the causes that we just mentioned is going to cause diffuse alveolar damage and increase in alveolar capillary permeability. Now, when there is an increase in the alveolar capillary permeability, there is going to be a leakage of protein-rich material along with neutrophilic substances into the alveoli. This protein-rich material is going to cause the formation of the intra-alveolar hyaline membrane, and the neutrophilic substance is going to cause damage to the alveolar wall. So basically, in acute respiratory distress syndrome, there's going to be high amounts of fluid that will end up getting into the alveoli and cause damage there.
Risk factors. Most people who develop ARDS are already hospitalized for another condition, and many are critically ill. You're especially at risk if you have a widespread infection in your bloodstream, which is sepsis. People who have a history of chronic alcoholism are at higher risk of developing ARDS. They're also more likely to die of ARDS. Complications. Some of the complications are pulmonary fibrosis, pneumothorax, blood clots, infections, abnormal lung function, memory, cognitive, and emotional problems. Test and diagnosis. Imaging. Chest X-ray and CT. Chest X-ray can reveal which part of your lungs have fluid in them and whether your heart is enlarged. A CT scan combines X-ray images taken from many different directions into cross-sectional views of internal organs. Lab test. A test using blood from an artery in your wrist can measure your oxygen level. Other types of blood tests can check for signs of infection or anemia.
And this is kind of the classic ARDS picture where we have the dense consolidation on both sides of the lung.
Heart tests. Electrocardiogram. This is painless and it tracks the electrical activity in your heart. It involves attaching several wire sensors to your body. Also, the echocardiogram, which is a sonogram of the heart. These tests can reveal problems with the structures and the function of your heart. Treatment and drugs. Oxygen. To get more oxygen into your bloodstream, your doctor will likely use supplemental oxygen or mechanical ventilation.
Dr. Oakler says close to 40% of all people who develop ARDS don't make it. Sean's treatment included medication to target the underlying infection and a ventilator to support his lungs.
Ventilators are the breathing machines that are really life-saving because we were really able with the machine to help him breathe while his lungs were healing.
Dr. Jeff Rabotin heads the respiratory care unit at Mayo Clinic. He says for many patients like Sean, ARDS can be very tough.
Fluids. Carefully managing the amount of intravenous fluids is crucial. Too much fluid can increase fluid buildup in the lungs. Too little fluid can put a strain on your heart and other organs and lead to shock. Medication. People with ARDS usually are given medication to prevent and treat infections, relieve pain and discomfort, prevent clots in the legs and lungs, and minimize gastric reflux.